Well, Mother's Day has come and gone, of course, but we're still looking out for moms here on WUSA 9 Mornings. We've all heard about the importance of health screenings, but now new data, it is showing that most women are still in the dark when it comes to getting those mammograms and colonoscopies. Whitney Stidham from eHealth joins us to help to clear up some of this for us. Good morning. Thanks so much for joining us this morning. It is interesting to note. It feels like I've heard for a long time now that you should start getting your mammogram at a certain age. I believe it's 40, colonoscopies at 50, but some people still aren't getting this message.
Yeah. Well, and you hit right on it, right? With it being Mother's Day and really all month since May is Women's Health Month, it's a good time to really be talking about this. And I was just with my mom this weekend, and even at age 40, my mom is still checking in on me,
Mm,
asking if I've had my annual wellness exam, making sure that I've scheduled to have my mammogram. And honestly, I listen to her. She's
yeah.
healthy at age 70. Her mom lived to be 107 years old.
Wow.
And I have a hard time believing that that happens by accident. I think it's really consistent preventative care, early detection, and showing up for yourself year after year, kind of like getting your car serviced
Right, right.
regularly, right? You don't wait for your check engine light to come on.
And it's really good to have an advocate or someone to give you that gentle nudge right there. But for people who don't or might not know when these timelines are, why are preventative health screenings so important?
I think here's the thing: women are so good at taking care of everyone around us, our kids, our partners, our aging parents. We're always looking out for them and making sure that they're taken care of. But we often put ourselves last. And it's important to make sure that you're getting your health screenings for that reason, right? It's preventative care. And eHealth did some research ahead of Mother's Day, and some of those numbers were pretty surprising. So half of us over age 30 don't know that mammograms are now recommended
Huh.
starting at age 40. Colonoscopies, 82% of us don't know that the recommendation dropped to age 45.
Hmm.
And on top of that, we have 57% skipping annual wellness exams at least once in the last 5 years. And these uh, appointments are free for the most part under health insurance. We're just not going. So really important to get that preventative care so that you have a long, healthy life.
Sure. And you mentioned that if you have insurance, they're pretty much free. How can patients balance, necessary screenings that might extend our life and other financial obligations?
Yeah, I think it's really just making sure that you set time aside to go to those appointments. That's where it starts. As long as you're, finding things early on, a lot of times, it's easier to solve if something does come up. And so, really important just to make sure that you're setting aside that time, meeting with your doctor, going through their recommended health screenings. Another one is mental health that often is recommended but skipped. And just making sure that you stay on top of it.
Wow. And it's so interesting. I thought I was in the know, but that colonoscopy date has dropped down a couple of years to 45. Okay, great information. Whitney Stidham, thank you from eHealth. We appreciate your time.
Yeah, thanks so much.